Governor Mike Pence calling out Hillary Clinton for wanting to turn Obamacare into a single-payer system.
Now, even former President Bill Clinton calls Obamacare a crazy plan. But Hillary Clinton and Tim Kaine want to build on Obamacare. They want to expand it into a single-payer program. And for all the world, Hillary Clinton just thinks Obamacare is a good start.
So would Hillary's proposal erode employer-provided coverage and push workers toward a public option? Here to weigh in on this is Fox News Medical 18's Dr. Keith Ablow and Dr. Marc Siegel. Thank you guys for being with us.
Great to see you.
What do you think about a public option, the single-payer public option?
I think that Governor Pence is right about this, because what Hillary Clinton has in mind is, first of all, to add a public option to the exchanges. Second, to say you can buy into Medicare at the age of 50 or 55. Those are both public options. Also, to give money to taxpayers, which sounds great, up to $177 million, Ainsley, are going to get $2,500 for single people and $5,000 for families to cut down on out-of-pocket costs. But that costs almost $100 billion to the taxpayer. The more money that's given to people to cover their insurance under Obamacare, the less employers are going to want to provide insurance for employees. They'll say, go to the exchange, get it from Obamacare. Why should we pay for it? You know, if there's a tax incentive paid by the government, employers are going to bail out. Right now, over half of our employees in this country are getting their health care through employer-based insurance since the Eisenhower years. That's the backbone of the system. If that erodes, we're going to end up with single payer.
Dr. Ablow?
So this is a land grab by Hillary Clinton and the government saying we want to control your health care. And we know what happens when the government controls things. Lower quality and increased waits and less time with your doctor. What's happened? They've choked the system. They've said if you want to sell insurance on this exchange, you're going to sell it in this way. And guess what? Companies can't make money. It's destroyed the profit motive and the ability of free enterprise to shape the system. So what do they then say? Well, now we've broken the system, we'll take it over. So this would be the equivalent of saying, here's how you have to make a car. And it has to have these options, and you got to sell it at this price. And then they come in and they say, well, since we bankrupt all of these automotive companies, we'll make cars as the government. Guess what? They won't run right. How many doctors now refuse Medicare? Tons of them. You can't get lots of doctors that way. We're going to have doctors in droves saying, I won't provide that.
Absolutely. Quality of care will go. It's like saying, you got to be on that train. Everyone has to have a ticket to be on that train. You get on the train, it's full. There's nowhere to sit. Quality of care will be affected. Doctors are dropping out. We already are choked by the amount of time we have to spend with computers. We're already quitting. Doctors are already giving up.
Why are so many insurance companies dropping out? Because yesterday we were reporting there are 24, I think, insurance companies that are bought in, and now there's 16.
Because they're sensible. Because they run the numbers. They say, I can't make money.
Because not as many kids are signing up.
Exactly.
Right?
Young people are not going on to it. Right. So the insurance have to pay for people with diabetes and heart disease and...
Exactly, and it's as Mark says, listen, it's a broken system that they then want to kill. They were the ones who broke it.
Right.
And the second thing is, I had a primary care doctor yesterday tell me, look, I can't make money in my practice. I said, are you going to sell it? Who would buy it, he said. Nobody can make any money.
Right,
primary care doctors have to see psychiatrists now.
I travel with him, so that he always has me. Usually we have a coach, but
thank you,
it's free. He doesn't charge me anything.
Yet.